you, Michelle, for joining us. We're really excited to have you on our podcast today, focusing on the proliferation of birthing centers and the Black community. And we are excited to have you here, especially with your book, Policing the Womb. So to start off, what led you to focus your research agenda on birthing people's reproductive rights, especially as it relates to Black birthing people?
So first, let me just say that I applaud this important work that you do. The work at the Legal Defense Fund has been transformational to American democracy, and it's been at the center of making our Constitution real and come alive. And so for this work, it's the work that we, in many ways, that we grow up with, the stories that we've been told over the years about the pain and suffering intergenerationally of Black women from the very first that Black women arrived in on these shores, which had been inhabited by Indigenous people. And it's really been through the oral history stories and then that which was then laid into writing that gives legitimacy to the experiences of Black women historically. And why I came into this space is, to be honest, as I was looking at other matters of reproductive health in the biotechnological realm, assisted reproductive technologies. 25 years ago, I noticed that as I was writing and recording what was happening there was something very different taking shape against Black women. So wealthier white couples could begin to design the families that were meaningful for them. And if they experienced infertility or other challenges, they were able to use assisted reproductive technologies. And with these technologies, it is very important that we have them available. They also have high failure rates. So there would be the cases of families that were gestating 4 fetuses, 5 fetuses, 6 fetuses. And there would be this welcome community response to that. And then sadly, in a number of those instances, there would be fetal demise, very difficult for a person to survive a gestation, or for a gestation of 6 to be able to survive. And so there would be fetal demise. And the response to the fetal demise was often very, very kind, very sympathetic, very empathetic. People would set up websites, funds. There would be calls from governors, even the president, things like that, in response to white people and their pregnancy outcomes that were not favorable. At the same time, I began to see that in parts of the South where we now have abortion bans, there were Black women that were being arrested, that were being charged with murder. There was Renee Gibbs in Mississippi being charged with depraved heart murder, a 16-year-old Black girl who experienced statutory rape and who had confided to her medical provider that during the course of her pregnancy, she had used an illicit drug, charged with depraved heart murder. Regina McKnight, charged with murder over having a stillbirth. So one could see what a dramatic difference this was, because with assisted reproductive technologies, it doesn't come from praying. It's the use of medical interventions. It's the use of drugs. It's the application of drugs on a regular basis in order to hyperstimulate the ovaries and create the conditions where such a pregnancy could take place. But the difference in terms of the policing, the surveilling, the lack of empathy, the lack of concern, this sense of let's just throw Black women in jail and toss away the key, was really quite dramatic. And so I began writing about it and I began talking about it. And there's much more to say just in terms of then how people would respond to that. I will tell you before we go on to your next question, that as I began to write about this and talk about this, amongst colleagues in law, the response was, but they're different. It's different when a white couple wants to have a family and a Black woman does. It's different when she takes drugs and there is a miscarriage or a stillbirth. When they're doing it, there's something noble that's happening in society. When she doesn't, the only response that we can have is that she is a bad mother. She's a person who should never have children. If she has children, those children should be taken away, and that incarceration is the right answer for her. Dramatic difference. And one can even see this today with regard to the opioid crisis, as there have been white mothers that have struggled with opioids. There is no such thing as the opioid mom. There is no such thing as the opioid baby. There's no referencing that those opioid babies, in which a term I would not exist, I would not support. But I am just saying to add the difference between 30 years ago and in the New York Times, Wall Street Journal, Washington Post, Rolling Stone, this terminology of the crack baby, and then describing this child as a menace to society and will be a menace to society. It's not the way in which we see any relationship to the reproductive health or the parenting of white families.
You hinted at this when you began talking. How do you see the historical legacy of controlling Black birthing people's reproduction connected to slavery, and how does that manifest in today's, modern and state regulations and control over Black women's bodies during pregnancy?
It's such an important question, and it's really important to pause and level set with it because we've become a society that quickly dispenses with slavery. The quick reference point is to think about a bucolic setting that's very lush and green, and Black people picking in a field and singing, and that's about as deep as we explore American slavery as a general matter in our society. As a general, that's where it hovers. There may be on deeper exploitation and deeper investigation or deeper interest. There may be people who say, well, yes, it must have been very cruel. It must have been some limited conditions in terms of how people lived. But even so, that's about as deep as a conversation goes, and it's not sustained. And we're talking about a backdrop where there are books now being banned across the United States that would explore anything more. And on the other end, there are books that suggest that Black people were quite happy and that they wouldn't have been able to survive, save for conditions of slavery. So it's an important question. And so I want to begin here. The very foundations of American law started with crafting exactly how Black women would be exploited. We must understand slavery for what it is. Like today, if it happened that groups of individuals, white swaths of individuals, went to a place and took people away who were on their way to meet their families, on their way to work, that were recreating, enjoying themselves. And if groups of people with arms, and here I'm talking about weapons and ammunition, then took those people away from going off to work, going off to meet their families, having dinner, we would say that that was kidnap. So the first is understand what that system was, a system of kidnap. And then if we were to understand, as factually happened in American slavery, and we'll talk about this, that then there were women and girls that were specifically set aside for breeding and to become breeding wenches, something that we know in American law, that we know through American advertisements, that we knew through Thomas Jefferson even writing to other planters, saying, on my plantation, I prefer to have women and girls because they turn a profit every year or two. We would recognize that as sex trafficking today, right? And so it's really important what in slavery was a system of kidnap. It were systems of trafficking, sex trafficking, labor trafficking, systems of sexual exploitation baked into law. And what do I mean by that? The very earliest American laws instantiated the following, that there would be matrilineity, and matrilineity means that children will take on the status of their mothers. This was distinct from how law was beforehand. The people who came to what became the United States from Europe were under a different system of governance. There wasn't this matrilineity that you inherit the status of your mother. But doing that in these lands basically set Black women up for sexual assault, for rape, for capitalism built upon their bodies and their daughters' bodies and their granddaughters' bodies and their great-granddaughters' bodies. And it also meant something else, which was that their children would never inherit the status of their fathers, including their white fathers who were plantation owners and who were overseers of plantation. It basically meant that people who owned estates, not all slavery was not always on plantations in New York. At a certain point, 40% of the household had enslaved people in New York off of Wall Street was the second largest slave auction block in the United States for a period of time. But whether it was a large plantation or it was an estate, it meant that there was profit to be made off of the birth of a Black girl's birth, a Black woman's birth. That's what that system was. But then there's the second one that follows in that system, and it's one of hypodescent. So we first have all of these laws that are about matrilineity. You take on the status of the mother. The second is that you can never exit out of this system, and that is the nature of hypodescent. We understand that as the one-drop rule. But baked into American laws was hypodescent. If you've ever been related to a Black person, you will always have the status of a Black person. And so what this means in places where enslavement was enforced, it means you never exited them. No matter how fair complected you are, and no matter if your father is white, you're trapped to this system of subordination. We know this. What's interesting about how we know this is that you don't find this on some dark page or some dark magazine. It's not like we have to dig far. The interesting thing is that you have people who owned enslaved Black women who put it out there, who advertised in newspapers when they wanted to sell them. They identified them as breeding wenches. And then we have to ask, well, what makes you a breeding wench, right? It was synonymous, sadly, with being Black and having female reproductive organs, that this makes you a breeding wench. And we also know this through advertisements where, through every sense of mercy and hope, these girls and women escape these plantations, and advertisements then about these escaped breeding wenches. And the ones that really hit it, they all hit at your gut. I have thousands of these that I've collected. They hit at your gut when you read about the 14 or the 16-year-old who was escaped, named Lisa, Maria, Patty, whatever her name happens to be. And that she has escaped with her children, her 2-year-old mulatto named Lisa. And you say, well, she was 16. And when she had Lisa, this meant that she was 14. How does Lisa become mulatto? And you see just within just a few lines, this horror that takes shape on the backs of Black women and girls, and that's not hidden. And then you'd have to ask yourselves what it means in a society where it's so normalized that as people drink their morning coffee and sip their morning tea or munch on their morning toast, that they read these advertisements, not hidden in the back pages, but you'll find oftentimes page 3, page 2, right up front, recorded in our American history.
The question becomes, what implications does that have on reproductive justice today and autonomy for Black birthing people? When I was reading your book, I was shocked by the statistics that you had on the maternal mortality rates for Black women in the United States, but even more shocked in terms of that connection with the South, that the mortality rates are higher in Texas and Mississippi and Louisiana. And so how does that carry through to today? And why is it still in the South?
It's a great question. It's a great question because we have never had a Truth and Reconciliation in the South, right? In the South, it's only been through federal intervention that we've even seen slow encroachments towards liberty. These systems didn't just disappear. And let me give you a sense of that across law. So many people know the case Dred Scott, for example, where Mr. Scott petitioned for his freedom. How it's taught in law schools is that if there's Mr. Scott, there's the Supreme Court, there's Justice Taney saying that Dred Scott will never be free, Black people will never be free, and they're inferior. What's not taught is that Dred Scott is there with his wife and his 2 daughters. He's petitioning for their liberty too. They've been rendered invisible. At the best of law schools, we don't talk about Dred Scott's wife and his 2 daughters, and his 2 daughters who were born on sea, not in states of enslavement, who were also fastened to that system, and what it would mean to actually hear why Dred Scott wanted his daughters to be free that connect us to this history. But that's not all. There's another case that we hear about, and that in the Dobbs decision where the Supreme Court overturned Roe v. Wade, they reference Plessy v. Ferguson over and again. They see Plessy v. Ferguson as a terrible case. But why do they see it as a terrible case? It's a case that's overturned by Brown v. Board of Education. But here's what's not talked about in law school when Plessy v. Ferguson is taught. It's a case that basically instantiates separate but equal in our society. But there's an exception in the law. There's an exception in this Louisiana law that makes Black people be in one car and white people in another car. The exception is Black women who are nursing white babies may be in the white car. Never taught, never explained in law school. And boy, what would it mean if we knew that? That Black women who surrender their breasts for the benefit of white families get to cross this color line, and how they must color this across this color line, not in dignity, but with their breast out to nurse white babies. It says a lot. And then as we turn into the period of Jim Crow, then what that means, this kind of horrific period in which Black people are suffering a second-class citizenship, slavery by a new name, a Jim Crow, a Jane Crow. And here to complicate the picture a little bit, it's worth just taking a pause about what's also happening to poor white people. And I want to talk about what continues to happen with Black people. But what happens to poor white people is an interesting part of the story. After slavery's over, there's a real question about what's the use of poor white people to wealthy white people. Poor white people had been fungible, expendable, and we really come to see this in the early part of the 20th century with the rise of eugenics. At the turn of the 20th century, it's considered that there are about 35 different categories of whiteness. There are the white people who are considered the Brahmins, the smart, the important, and then there are those that are thought to be no higher, right, than almost Black people. And those people are put forth for sterilization or coercive sterilization. We enter this period of eugenics in this country. There is a Virginia law that provides for the rounding up of poor white people and to put them in a colony called the Virginia Colony. And from there, they're coercively sterilized. Poor white girls as young as 10, 11, 12 years old. And a case goes before the United States Supreme Court to determine whether this is legitimate. Can this really happen? And Justice Oliver Wendell Holmes, in a shocking opinion, says 3 generations of imbeciles are enough. Better than to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind. And you might think, if that can happen to poor white people, what's in store for Black women? Because from that point on, tens of thousands of poor white people end up being sterilized. The law that is upheld by the Supreme Court becomes the foundation and base that's used in Nazi Germany for their eugenics platform, such that when Fannie Lou Hamer, a couple decades later, begins talking about this Mississippi appendectomy, it too is about this coercive sterilization. In this case, it's the coercive sterilization of Black women because Black women have now begun to advocate to get what is being provided to white women. If poor white families can get welfare benefits and other benefits from the government, then Black women should be too. And this is when the coercive sterilizations begin to take shape and happen overwhelmingly. And I can't help but think about a couple of things combining in the story of that. And again, this legacy that continues on, right? It's continuing the very same states that practice slavery. It's these very same states that create these laws, these kinds of conditions. And it's worth noting that in these places, there has never been the effort to reconcile that past. So when you think about what the muscle memory of Mississippi, Alabama, North Carolina, South Carolina, Louisiana, Texas is, that muscle memory from the 1600s, 1700s has always been the exploitation and harm of Black women. That may seem shocking to some people, but think about it this way. That muscle was doing push-ups, was doing sit-ups and backflips, not for days, not for weeks, not for months, but years that went over into centuries. And if anybody doubts that, think about this. In 1865, the 13th Amendment was ratified that ended slavery and involuntary servitude. Mississippi, the state that brought us the Dobbs case, ratified the 13th Amendment in 2013. What's the muscle that's been used? And it's been a muscle that's been used in every kind of way to gerrymander Black women's lives. And never has there been a pause amongst those legislatures, never, to say, here's the apology that we need to issue. Here is what we did wrong. Here is what we recognize. Here is what we want to atone for. And here is our 10-point plan in terms of how we're going to atone for these centuries of mistreatment of Black women, Black girls, birthing people, Black men. Never. It has not happened. That's a day that we are still waiting for.
I think that leads into my next question. I think you clearly answered why would, and specifically in the South, there be the proliferation of these laws prohibiting and regulating midwives and birthing centers, and in particular in rural areas in the South where Black birthing people don't have access to, adequate resources. Can you talk a little bit about that, carrying it through to today and those laws that have come out?
It's the laws and the conditions kind of retrofitting over and over again, being nimble around Black people's bodies, around Black birthing people's bodies. And there's so much more of this history that we could unfold, including the fact that Black women and the majority of midwives in this country, it's not until around the time of the Civil War that abortion becomes criminalized. And it is directly connected to this theory that we hear today, the replacement theory. It was the same then. It wasn't called replacement theory around the time of the Civil War, but that was the theory behind it, that if Black people are freed, then Black people will overwhelm the population of white people. Well, today, this unfolds in myriad kinds of ways in the American South, that there are, and some parts of the North now too, and that there are bans on abortions with no exceptions for rape or incest. We've seen the growth of what are called crisis pregnancy centers, which are these centers that purport to take care of people, to take care of their offspring, to provide medical care, to provide information about what would all be the options for a pregnant person. But that's not really what they do. They also try to cheat the algorithms, one might say, on search engines like Google and Firefox, where if somebody is looking for something in reproductive health care, their advertisements will come up first, such that a person might be looking for an abortion. And what will come up first is not necessarily the abortion clinic in the area, but instead something that parades as one, these crisis pregnancy centers, which often, as a foundational matter, treat people in coercive ways. And what I mean by coercive ways is that misinformation is part of the foundation of what is shared with people. They'll tell people that abortions cause mental health issues, that abortions cause breast cancer, that abortions cause brain tumors and myriad other things. They'll caution people against the use of birth control and all of that. Now, it might be hard for people to try to reconcile then what all this means. On one hand, there is the effort that Black people must be bred. It takes place in one state. And then it's Black people being sterilized. And now it's Black people being duped. And you think about a state like Mississippi, where funds that were intended to help families in need and families who need food and families who need housing, that those resources funneled into crisis pregnancy centers and also into a volleyball court for a former football player's daughter's school. But these are not places that further help to uplift individuals in those communities. And I think probably connected with your question, it's important to note that places like Mississippi, Texas, Louisiana, where we see this proliferation of these crisis pregnancy centers that claim that they're going to help people after their pregnancies go to term and do not. At best, someone's going to get a few Pampers, a few diapers, and that's going to be about it. But in the backdrop of this, the incredibly high rates of maternal mortality, maternal morbidity. In Mississippi, according to the state's own data, 80% of the deaths, cardiac deaths during pregnancy, befall Black women. Black women don't make up 80% of the birthing population in Mississippi, but they will be 80% of those who die from cardiac arrest in pregnancy in that state. One could unpack all the reasons why, the stresses, the strains, the horrific conditions under which people live, and we could talk about that too.
The thing that I really like about your book is how you place an emphasis on how the conversation around reproductive health uh, is focused on abortions. And since we just had the Dobbs decision, I was wondering if you could explain to our audience how limiting, reproductive rights on abortion and pregnancy termination limits our understanding of reproductive health decisions and the broader spectrum of choices that people have to face when they're giving birth.
I'm so happy that you asked that question because this is something that literally for decades I've been talking about. If you think about the civil rights movement, it's a plural, civil rights. It has an S on the end of it, meaning that there wasn't this sense that brown should be enough. And now let's close the door and go home. We don't have to worry about housing. We don't have to worry about employment. We don't have to worry about the environment. We don't have to worry about access to recreation parks and accommodations, right? That wasn't the sense. The sense was in every aspect of life, civil rights and civil liberties should exist. And so it was not enough just a decision that related to education. Well, in the space of reproductive rights, even though it's been a plural too, the attention has primarily been on abortion. And in many ways, that has underserved the people whose interests are in preserving abortion rights. And it has been devastating for all other reproductive health freedoms. That means that attention needed to be and needs to be on sex education. We have children in the United States, young people, adolescents who have no clue about their bodies, such that then it's not a surprise that the United States leads all peer nations in terms of sexually transmitted diseases amongst youth. And what we know through credible science is that sexually transmitted diseases experienced in one's youth lead to deadly cancers later on. And so it is not serving young people by denying them the education that they deserve to know about their bodies. But we see dramatic encroachment on that could have been addressed pre-Dobbs, but wasn't. At the same time, contraceptive access in every kind of way is also something that was not available to all people, but should have been an eye on that in every kind of way as well. Deciding to be pregnant and give birth was something that was major and overlooked by reproductive rights organizations that were focused primarily or solely on abortion. In the United States, people should be able to carry a pregnancy to term without morbidity and without dying. The United States leads all peer nations and some in terms of maternal mortality and morbidity. We rank 50th in the world in terms of maternal mortality. What does that mean? Quite literally, nations that have experienced recent genocides, recent wars, do better in keeping women alive during their pregnancies and afterwards, and their babies too. We have alarming rates of maternal mortality. In fact, just before the Dobbs decision, now Texas and Louisiana battle it out, but the dangerous places in the entire industrialized world to be pregnant, right? And so if we paid more attention to understanding that reproductive rights should include the right to be pregnant and survive. But let me tell you about a reproductive justice 2.0, that it also includes the right, the ability of your children to survive. For your children to be able to survive more than a week, 2 weeks, a month. Mississippi has one of the highest infant mortality rates in the nation and beyond all peer nations. It's not a guarantee that even if you get to the point of delivery, that afterwards your child will survive, given all of the conditions of pregnancy, given all of the conditions of the state. And I would actually add to that, and thinking about Tamir Rice, thinking about Trayvon Martin, thinking about Black kids who have suffered the horrors of stalking, of surveillance, and death. Reproductive justice should also mean that your children get to make it through childhood without being policed and gunned down in their neighborhoods or when visiting their friends. And we have to connect these matters together. And then we could stitch together so much of that. The environment in which you live that should be healthy, where you should be able to drink your water in Flint, Michigan, or Jackson, Mississippi, where your kids can go out and be able to fly a kite in the park and be able to breathe clean air. And here I'm talking about Cancer Alley in Louisiana. So there's so much more that should have been the work afoot under reproductive rights.
You mentioned in your book several times how Black people and people of color are the canaries in the mine in the reproductive justice discourse. Your methodology certainly center Black birthing persons, and you're using the names, calling, into the conversation, people who have been impacted all the way from slavery to the present day. So how can advocates and lawyers develop this practice that you are showing here in terms of challenging these reproductive issues and centering the communities that are most impacted by these issues?
It's such a pleasure to be interviewed by you, because these are such important questions. And we have to be, we have to approach these matters with integrity and with accountability and with a sense of doing what is right, even if it may be something that is not in favor. I was doing this work and writing in this space at a time in which others were really understanding reproductive rights as being just about abortion. And we're not paying attention to Black and brown people. And it was really important for me that we do that. And also important for me during those times that we also lifted up other spaces within our communities, LGBTQ folks who are experiencing harms within our society. And so it's actually not so difficult, but we have to pay attention. And I think that that's the piece that's really important, is to pay attention to the lives that are around us and to not treat them as fungible, expendable, non-important, non-essential, because we hear these stories. I think about Brittany Watt in Ohio, the Black woman who was criminally charged after having a miscarriage in her home, even though she had consulted doctors several times, each time sent home in complete medical distress. And how police came to be alerted about her, strangely, horrifically enough, came from hospital officials themselves who reported her. And then we have to be mindful about the very strategies that take place on the ground, because technically, Brittany was being charged not for the miscarriage, although that was really what it was about, but instead abusing a corpse, right? So the very way is being alert to the ways in which there will be a kind of nimbleness amongst prosecutors to fashion new ways of policing Black and brown birthing people. And so we have to be mindful about that, keeping an ear on the ground. And, one other point that I would like to make is that we have to see all of these issues as being within the umbrella of a civil rights, a civil liberties discourse. And that means also, even within communities, paying close attention to those within our communities who happen to be most marginalized, who happen to experience oppression. And I know that there are times in which we put that on the back burner, right? Because we think, well, we must do the racial uplift first. And after that is taking care of these other aspects. So, I think time out for that. And I think the mothers that date back to the 1800s, and I think about a Sojourner Truth, ain't I woman, in a speech about I birthed 13 children, it's on nearly each one snapped from my arms, and nobody heard my cry but God, ain't I a woman, right? I mean, we owe so much to this legacy, this incredible legacy that we have. And if I could add to that, I think about what has sustained Black communities over time across these generations. So much of that was connected to the messaging that took place from our great, great, great grandmothers who figured out strategies around what were horrific federal laws, horrific state laws, the societies that refused to see Black people's personhood, their dignity, their integrity. And what sustained us over time were, in fact, our great, great, great grandmothers who had something to say, something that was meaningful to keep generations going.
Thank you so much. I have one more question. I know we're almost at time. So could you speak on how the anti-abortion advocates are weaponizing racial justice arguments and how this manipulation ignores the key tenets of reproductive justice?
Well, it is a weaponization, and it's such a cynical weaponization that's intellectually hurtful. Now, I did tell you about Fannie Lou Hamer and what happened in the 50s and 60s when Black women were demanding the incorporation of welfare rights and other kinds of social services. But eugenics in the United States was explicitly white. And this is the part where it's so cynical, where it's disingenuous, where it's intellectually a departure, in that in Buck v. Bell, this 1927 case, which legitimizes eugenics, Justice Oliver Wendell Holmes, who describes who Carrie Buck is. And he describes her, and she was a poor white girl from Virginia. It was a campaign against poor white people. And there was white supremacy within whiteness. As I mentioned before, there was a campaign to get rid of poor white people, and it was ridiculous, and it was harmful, and it was hateful. But that was our history of eugenics in the United States. And what makes it so cynical is that it was a Supreme Court case. It was not a case about Black women still on Southern plantations in the 1920s or about Black women sharecroppers. It really was, how can we do away with poor white people? And for anybody who would like to see the visual of this, go to the Library of Congress, where they had images, many of them, of the Fitter Family Contest in the United States in the 1920s and 30s, and they are all white. They're all white, trying to show that, look, we're fit. We're not the people that should be sterilized. And remember that during the time of Jim Crow, Black people were very profitable for exploitation with labor, right? And that was how the South saw Black people, right? Here is labor for our homes, labor for our gardens, labor for the trains, and then still prison convict leasing that was taking shape. So there was a use for Black people. It wasn't coercive sterilization in eugenics.
Thank you so much. Is there anything else you want to add that we didn't include throughout the interview?
I want to thank you for giving me the opportunity to speak with you. I think these are incredibly important histories. Let me close with this as a point of imagination. Prior to the Civil War, the majority of midwives in this country were Black women, but it was an enterprise of Black women, white women, Indigenous women. And it's not a surprise that nearly 100% of reproductive health care taking shape in the United States was being performed by women, just as it would not be a surprise to think about that millennia ago. There weren't guys with stethoscopes and white lab coats basically saying, okay, open, you're like, let me examine you. That was not happening. This was the knowledge base of these women. And if we could take a moment and think about what it would have meant in a period after slavery for Black women with all of that medical knowledge to be able to translate it into meaningful careers in the early part of the 20th century, what it could have meant for these women who were a step away from being able to practice medicine with a title after their name after slavery, just what that would have meant for our society, for the livelihoods of those women. It says a lot that still hasn't yet to be unpacked about what was denied our communities. And when I say that, denied to everybody, when we don't have Black women as medical doctors, that's a shame on us all. It's a shame for our entire country because they did the work and they did the work successfully.
Thank you so much. This has been so informative.